Thanks, Anthony, for the introduction and invitation. It's great to be here. And I'm definitely going to sign up to the mailing list and join the future talks, which sound really interesting. So I'll be presenting on protecting against researcher bias in secondary data analysis, which is a slight deviation from my kind of normal research focus on childhood trauma and mental health. But I became really interested in meta-science and pre-registration and things like that. I will begin now. Okay, so as humans, researchers are vulnerable to a range of common cognitive biases, which can affect the way that we analyse, interpret, and report data. So these biases include things like apophenia, which is the tendency to see patterns in random noise, confirmation bias, the tendency to selectively focus on information that's consistent with our beliefs or preferences, and hindsight bias, which is the tendency to view past events as having been predictable. And together, these researcher biases can contribute to what we call questionable research practices, which include things like p-hacking, so testing something in multiple different ways in order to get a statistically significant p-value. Selective reporting, which involves running multiple tests and only reporting those tests which lead to significant results or novel, surprising findings, or those with a kind of clean narrative. And harking, which stands for hypothesizing after the results are known. So this is when you make up your hypothesis after you've already got the results, simply to fit with your findings and make them seem more compelling. And in secondary data analysis, the scope for these researcher biases to kind of distort the evidence base is particularly acute for a couple of reasons. So firstly, we have access to kind of highly dimensional data sets, which offer many different ways to analyse the same research questions. And research shows that different analytical choices can lead to different findings. And secondly, our current kind of incentive structures in science and epidemiology really rewards us for publishing significant or novel or surprising findings. And obviously, our publications are really important for our career progression. So this kind of combination of both opportunity with the data sets as well as incentive can lead researchers to run many different analyses and only report those that have the kind of most publication-worthy findings. And one way to protect against these researcher biases is to pre-register study designs and analysis plans, for instance, on the Open Science Framework or OSF. And basically the idea is that by pre-registering your hypotheses and your research questions and analysis plans, this reduces the scope for p-hacking and selective reporting, as well as hypothesizing after the results are known because you've already put your pre-registered hypothesis. And there's some evidence from meta-science studies that pre-registered studies are more likely to report null findings, small effect sizes, and they're also more likely to be replicated compared to studies that aren't pre-registered. So there's some initial evidence that pre-registration is helping to kind of reduce some of these practices and increase replicability. But based on my own experiences of pre-registering and also conducting a registered report, which is when your pre-registered protocol is peer-reviewed before you start the study. And also from talking to colleagues and collaborators who are interested in pre-registering but working in secondary data analysis and epidemiology, we felt that pre-registration can pose some challenges for researchers working in secondary data analysis. And so in this talk, I'll discuss some of these challenges and also suggest some potential solutions that we could implement to either make pre-registration more feasible or effective, or which could present an alternative approach to mitigate against some of these biases. Okay, so the first challenge that pre-registration can bring is if you have prior knowledge of the data. So researchers working in secondary data analysis commonly analyse the same data sets multiple times throughout their careers. And this is usually for good reasons, because these data sets have really good measures or kind of strengths in other areas that mean it would be a waste if we were to only use them once. But the kind of challenge that this can bring is that if we've already accessed a data set and have knowledge of it, we might have some potential insight into the findings before we've pre-registered. And so we might be slightly biased, even if it's subconsciously, to pursue certain questions because we already have some insight into those results. And I think even in a worst case scenario, researchers that have already accessed a data set might have looked at run multiple analyses, identified those that lead to kind of significant findings, and then decided to pre-register those analyses under the guise of having no idea what the results would show, and then benefiting from the kind of additional credibility that pre-registration can kind of bring to your study. But I think even if we've not done that, we may still have some indication based on looking at similar things, or even from reading papers from colleagues that have looked at similar questions in the data sets. So I think at minimum, if we've already had some insight into the data, it's really important to report your prior access to the data in your pre-registration. So for instance, including information like for each of your co-authors, stating whether they've accessed the data set before. If so, which of the key variables have they accessed, like exposure variable, outcome variable, and citing the publication arising from use of that data. And this can be provided on the OSF in your pre-registration, and it's actually now asked about in the template that's used for pre-registering secondary data analysis. This kind of relies on self-certification from authors, so relying on kind of their honesty. But maybe a more objective way to do this would be if data sets actually recorded which researchers had accessed the data sets or downloaded them, the variables that they'd accessed, and then made this information public so that other researchers could say search in a spreadsheet for their co-authors, download this information and just upload it with their pre-registration. And obviously just reporting whether you've accessed the data set previously doesn't mitigate any bias you might have from like knowledge about the data set, but it does make the bias transparent to readers who check your pre-registration. But for a more rigorous way to really protect against bias arising from prior knowledge of a data set, researchers could consider using a multiverse analysis. And a multiverse analysis basically involves identifying every justifiable way that you could analyze a particular research question. So this would include things like different ways you could operationalize a variable, different ways to kind of code a variable, different statistical models that could be justified, different covariates that could be justified and how those covariates could be measured. And then once you've identified all of the potential analytic choices that could be made, implementing these, and these are termed specifications in a form of multiverse analysis called specification curve analysis. And when you think about the different combinations of analytic choices that you might identify, it's kind of easy to imagine that this could lead to hundreds or even thousands of different specifications. And then after you've run those results, then reporting the results across all analytic choices or specifications. And this is an example of a multiverse analysis that was used by Amy Orbin to look at the relationship between digital technology use and adolescent well-being. And you can see here the different analytic choices that were implemented. So different ways to operationalize technology use, mental health or well-being, different informants reporting on these measures, and different statistical controls. And the dots here represent the particular choice that was implemented. You can see that they implemented 20,000 different specifications. And then up here, you can see the effect size that's kind of plotted against the particular analytic choices or specifications. And you can see that there's quite a lot of variability in the effect size. So ranging from a moderate negative effect, whereby more technology use is associated with lower levels of well-being, to a small kind of positive effect where more technology use is associated with slightly greater well-being. And then the average effect size is plotted here. And so the benefit of this approach is that by showing the results across all defensible analytic choices, it really reduces the scope for selective reporting and p-hacking. And it also gives insight into how robust the findings are against analytic choices. So it's really beneficial for instances in which researchers have accessed a data set in the past, because although they might have some insight into potential findings for a few associations or a few statistical models, it's really unlikely that they would have insight into the results from across thousands of analyses testing the same question. Obviously, I think one downside of this approach is that it's quite computationally challenging and demanding to run all of these models, especially if you have a really large data set. But there are packages that are being developed in R to kind of make the process more efficient and standardized. I think it could also be quite cognitively challenging to come up with all of these analytic choices, but I think if you kind of implement some software to generate all of the different combinations, it could make that a little easier too. Okay, so the second challenge of pre-registration for secondary data analysis is that research may not be hypothesis driven. And so pre-registration and registered reports are really tailored towards confirmatory hypothesis-driven research. But much of kind of epidemiological research based on secondary data analysis could be descriptive or exploratory or more focused on estimation. So testing the magnitude and robustness of a relationship rather than testing a kind of point null hypothesis or a very specific theory. And I would argue that that studies don't need to have a hypothesis to benefit from pre-registration, and that researchers can pre-register research questions instead of hypotheses, as well as analysis plans and conditions for interpretation. So pre-registering research questions and analysis plans will obviously reduce the scope for selective reporting, and pre-registering conditions for interpretation can help to limit post hoc interpretation. So interpreting findings in a biased way once you've got them, maybe to kind of oversell them or overestimate their importance or magnitude. And I think it also reduces the scope for hypothesizing after the results are known if you've pre-registered, because readers can check your pre-registration and see that you've not included a hypothesis there. And there's already been kind of detailed guidance given in a really helpful tutorial by Olmo van den Akker about pre-registration for secondary data analysis. And that relates to how to pre-register research questions and analysis plans. But in terms of pre-registering conditions for interpretation, it's important to kind of anticipate as much as possible the different results that you might get, and in advance think about how you would interpret each one. So as an example, if you were testing whether X is causally related to Y, and say that you had really good longitudinal data, you'd accurately measured all of the potential confounding factors, and you had high statistical power, you might expect 3 different sets of results. So firstly, if your association between X and Y after adjusting for confounders was similar in magnitude to the unadjusted association, you might conclude that this is likely to be a causal relationship. Whereas if you find that your adjusted association is attenuated from your unadjusted association after accounting for confounders, but it's still greater than 0 and it's still kind of sufficient magnitude, you could conclude that it's partly confounded, but also likely to be partly causal. Whereas if your adjusted association was completely attenuated, you could conclude that this is unlikely to be causal and it's likely to reflect confounding. And you can also add additional details to be more specific and constrain the kind of post hoc interpretation even further. For instance, by specifying effect size thresholds for interpretation, so what you consider a small or a medium effect, and things like the smallest effect size that you consider to be practically or clinically meaningful, which can be used in the context of equivalence testing. So the more specific you can be, the greater this kind of constrains your post hoc interpretation. And I think it also makes your interpretation a bit easier down the line because you've already thought through all of these scenarios. And so if you're interested in using exploratory research and you would like to kind of integrate that into a pre-registered confirmatory framework, one potential solution is to use a holdout sample approach. So this involves taking a data set, which needs to be kind of sufficiently large, and then splitting that randomly into a training data set and a holdout data set. And the training data set should be smaller than the holdout data set. And then you can conduct exploratory analysis on your smaller training data set in order to kind of more flexibly run exploratory analyses and make new discoveries. And based on the results of this exploratory analysis, you might identify some hypotheses that you want to take forward, which you would then pre-register to test the more confirmatory analysis in your holdout sample. And so this approach basically involves a kind of flexible discovery process before testing hypotheses in a less biased way in your holdout sample. And it can be useful for when access to independent data sets is limited. Obviously, if you've got lots of independent data sets that you can access, then you wouldn't necessarily need to split your data set into 2. Okay, so the third challenge that pre-registration can present is ensuring that your pre-registered analyses will be appropriate for the data. So I think this can be a challenge for pre-registration of a range of different types of analyses, like based on primary data as well as secondary data, as there's always a risk that your data might violate some of your assumptions of your analysis. But in secondary data analysis, I think the potential for this to happen is greater. So, for instance, in longitudinal cohort studies, there's often missing data and attrition. And it's really, or you really need to know the patterns of missingness and the extent of the attrition before coming up with a strategy to address this. So you do need some kind of insight into the data. There are also other types of secondary data like electronic health records and other kind of official records which were never collected for research purposes. So they can present lots of challenges that are really difficult to anticipate in advance of actually seeing the data. And then there are other issues like collinearity between variables and things like that that really affect the types of analyses and the choice of covariates that you might implement. So one kind of solution to try to address this is to trial your analyses on a blinded data set before pre-registering, in order to kind of refine them and make sure they're suitable for the data. So by a blinded data set, I mean one in which some of the values are obscured. So you may have some insight into things like the distribution of the data, but you won't have insight into the overall findings. And one example of a way to blind data is a technique called data scrambling. So this involves taking a data set and randomly shuffling the values either by row or column, so that they're in different cells. So if we just look at this kind of simple data set and focus on the variable 1, in the original data set, we'd have values of 5, 3, and missing. Then after scrambling by column, the values, they become 3, missing, and 5. So the values are the same, but they're just in different cells. And importantly, this means that the data distribution is the same in the scrambled data set. So your means and variances will be the same. The amount of missing data will also be the same. So you can assess this. But importantly, any associations between variables will be different. So you won't gain any insight into your findings, but you will be able to kind of assess the distribution and missingness. So this could be something that data managers could provide to researchers before they pre-register. So the researchers can kind of test trial their analyses. If there are any issues, refine them, and then pre-register their study. This data scrambling isn't necessarily a solution that would solve all of your problems, because not being able to see associations, although it kind of prevents you from having insight into the results, it can mean that you can't check things like collinearity between variables or predictors of missingness, for instance. But in order to kind of be able to check those things, you could also try trialing your analyses on a data set which is missing data on the outcome. So for instance, you could have a look at a data set that includes your exposure variables, any covariates, but with no data on your outcome. And this would allow you to check multivariable distributional characteristics among your exposures and covariates. So to check things like collinearity and predictors of missing data. And if you still wanted to have some kind of idea about, say, the distribution of your outcome variable, it would be possible to combine this approach with the latter, or with the former approach. So you could receive a scrambled version of your outcome variable, for instance. So you'd still be able to understand kind of the distribution of that and the amount of missingness. And I think that these kind of techniques would ideally be done by data managers before the kind of researcher would pre-register. And I don't think it would involve too much extra work for data managers, seeing as they would compile the data set for the researcher anyway. they would just need to maybe delete an outcome variable or just implement a few lines of code to scramble the data set first. But it could be really helpful for researchers. Okay, so the final challenge that I think pre-registration can pose is a lack of flexibility in data analysis. And many people have kind of raised concerns that pre-registration can prevent important flexibility that's needed to, say, follow up on interesting kind of unexpected findings, or to implement a new method that's come out since the study was pre-registered that has real advantages over the pre-registered methods. I think that these concerns are perhaps overstated because pre-registration doesn't prevent you from including unplanned analyses. It just encourages you to transparently report them as unplanned. And kind of research has actually shown that most pre-registered studies do deviate from their pre-registered plan at some point, whether that's doing something different or including additional kind of exploratory analyses. So I think this is actually a natural and important part of the scientific process, as it is really hard to really accurately predict exactly how your analyses are going to go and all the specifics and things like that. But as long as you transparently report the unplanned analyses, so this can include in your study, for instance, explaining what changes you may have made, the reason for the change, and ideally reporting your results from, say, your original method if you've deviated methodologically, to show that you've not deviated because of the results, but because of some additional, say, advantage in the method. And if you prefer, you could also post an update to your pre-registration. Now kind of the OSF now allows for amendments to the pre-registration, explaining what you did differently. And so this is linked to your pre-registration. Okay, so another kind of challenge that I think the lack of flexibility, or perceived lack of flexibility, that pre-registration might bring is that, as I mentioned, pre-registered studies are more likely to report null results. And although this is a really good outcome for research integrity, I think that, well, we know that null results are actually more difficult to be published and they're less likely to be cited. So researchers might be concerned that by kind of limiting analytic flexibility and increasing their likelihood of having to report null results, pre-registration could make it harder for their study to be published. And I think one solution to this is to ensure that the paper's value doesn't depend on statistically significant results. And I think I may be preaching to the choir here, but I think there are a number of different ways that this can be achieved. So the first is to use really high quality methods, because I think methodologically sound studies will be interesting regardless of the results, because they'll make an important contribution. So doing things like making sure your study is highly powered, making sure you've got valid and reliable measures, implementing robustness checks to kind of test alternative explanations for your findings, and using replication samples to check whether your findings replicate or generalize to different contexts can help to do that. You may also want to implement alternatives to null hypothesis significance testing, such as using Bayesian methods or equivalence testing. And this is because in null hypothesis significance testing, if you get null results, it's quite difficult to interpret those, because technically you can't conclude that, say, there was no difference between your groups, or that the groups were similar or equal. All you can really conclude is that you don't find evidence for an effect. So that can make kind of the interpretation a bit challenging, whereas these methods allow you to better interpret null results. And I also think something that I haven't put on the slide, but not having a huge focus on p-values and whether it's below 0.05 or above, but more focusing on confidence intervals can also kind of get away from this p-value dichotomy. And lastly, I think arguably the most powerful way to protect against publication bias is to use a registered report format. So this is where your study is your pre-registered protocol and your background section is peer reviewed. And if the reviewers deem it to have kind of real importance in terms of the topic and high methodological quality, it will be accepted in the journal and they'll commit to publishing it regardless of the results. So I've recently finished a registered report, and it was a real relief to have it accepted at stage 1 and to know that it really didn't matter what results I found because the study would be published regardless. So yeah, your p-value doesn't matter. Okay, so moving on to the summary. I think pre-registration can pose various challenges for secondary data analysis. So having prior knowledge of the data, if your research isn't hypothesis driven, that pre-registered analyses may not be appropriate for the data, and challenges that come with reduced analytic flexibility. But the approaches that I've described aim to address some of these challenges. For instance, if you've got prior knowledge of the data, then reporting your prior data access in the pre-registration can make this transparent, or conducting a multiverse analysis can protect against kind of selective reporting. If your research isn't hypothesis driven, then you can focus on pre-registering research questions and specifying conditions for interpretation. Or if you wish to integrate exploratory analysis into a pre-registered framework, you could use a holdout sample approach. If you're concerned that your pre-registered analyses won't be appropriate for your data, you could trial the analysis on a blinded data set, for instance, one that's scrambled or missing your outcome variable, and then refine your analyses ahead of pre-registering. And if you're concerned about reduced analytic flexibility, you can conduct as many kind of unplanned analyses as you want, as long as you report the deviations or report results as exploratory, which weren't pre-registered. And also take steps to ensure that the value of your study isn't dependent on statistical significance if you're concerned about getting null results. So I think, as well as the responsibility kind of falling on researchers to adopt these methods, data managers also have an important role to play. So for instance, in recording and researchers' access to data and potentially reporting that to make this more transparent, by providing blinded data sets to researchers so they can trial their analyses ahead of pre-registering, by kind of providing holdout data samples, and more broadly encouraging pre-registration. And in some cohorts, for instance, the TED sample, which is the Twins Early Development Study in the UK, pre-registration is actually mandatory in order to gain access to the data. As well as kind of data managers, I think funders and journals can also help to incentivize these practices. For instance, funders could provide grants to provide best practice at the cohort or dataset level, for instance, in recording access to data from researchers, or providing blinded data sets and seeing how that actually works in practice and if it's helpful. Journals could do things like providing designated space in manuscripts where researchers can report deviations from the pre-registration, to kind of normalize this and encourage people to give sufficient detail rather than kind of pretending it didn't happen, not being transparent in that sense. And overall, I think incentives and changes that increase the ease of adoption of these and other open science methods will lead to wider uptake. And so efforts are needed to kind of evaluate these approaches, simplify them and improve them so they're easier and faster to use. And I think more broadly, this links to a general point that researcher biases don't operate in isolation, but in the context of wider publication bias and also a publish or perish culture. And these current incentive structures not only promote questionable research practices, they also discourage researchers from pre-registering and adopting reproducible methods, which are, of course, quite time-consuming. So wider initiatives from journals and funders are really required to address these more institutional biases. And I think systemic changes that can reward rigorous and reproducible research will be beneficial, not only for researchers, because we'll be able to do things properly and actually test things in a kind of unbiased way, but will also be beneficial for society because we'll be producing kind of reliable and robust research that's really needed to make advances. So thanks to my collaborators and funders. If you're interested in checking out the paper, it's published as an essay in the European Journal of Epidemiology. And I'm happy to take any questions.